Good evening. Thank you very much. Sorry, Josh, feedback. Sorry about that. Good evening. Thank you very much for joining us this evening. My name is Nima Hussain, and I am your chair for this evening. Well, a very special welcome as well to our all-women panel of speakers this evening. Thank you for joining us today. So it's very clear that the situation is deteriorating rapidly in this country with regards to COVID, even before the schools have reopened. Cases, hospitalisations, and deaths are all climbing. Some critics of zero COVID have claimed previously that it was only cases that were rising and that the vaccines were preventing hospitalizations rising and preventing deaths rising as well. Unfortunately, that's actually no longer the case. Worse, government ministers themselves claim the pandemic is over. That too is clearly untrue. So I want to welcome our panel this evening. Again, an all-women panel, I'm delighted to say. And between them, they will examine the current situation, tell us about some of the hardest hit, and outline how we can continue our fight for zero COVID. If you do want to join the conversation on social media and join the conversation about this meeting in particular, our hashtag for this evening is can't live with COVID, can't live with COVID. Thank you. Our first speaker tonight is Diane Abbott MP and co-convener of the Zero COVID Coalition. We will just switch now to her pre-recorded contribution.
Good evening. I would like to thank you all for attending this meeting and a special thanks to all our speakers. For days, if not weeks, I have been hearing so-called experts telling us that we have to learn to live with the virus. My view is that that is the wrong position to take, because living with the virus means that people will get ill, people will get long COVID, and people will even die quite unnecessarily. Talking about living with the virus is a way of avoiding adopting the correct policies and taking the right decisions. Nobody can be reassured by the fact that government has allowed schools to reopen, but they seem to think they can get around to vaccinating children in their own sweet time. If the policy of vaccinating children is correct, then it should have been done before the schools reopened. Meanwhile, in England, there has been next to nothing done to provide ventilators in schools, as the Welsh Labour government has done. There was also nothing like the catch-up classes required, which could have been done easily via TV. I support the campaigning of the teachers' unions and others on these issues. They are fighting for better outcomes for the sake of public health across the whole of society, not just in schools. If children should be vaccinated, then this should have been thought of and implemented before the schools reopened, not afterwards. But at every stage of this pandemic, government has been too slow, done too little, and ended too early practical measures to protect public health. But when it comes to promoting the interests of business, government has been too quick and too quick as well to protect and promote the interests of its friends in business. To give an example, the trace part of the test and trace system appears to have expired completely. Tracing apps are barely used in many establishments now. So that was £37 billion of public money that was thrown at the government's friends in the private sector with hardly any tangible results. In fact, we have one of the worst test and trace systems in the world. It's certainly the most expensive. It ended by being a bonanza for the firms that got the contracts, but did precious little for public health. And this dereliction arises because the government insists that the pandemic is effectively over and we can go back to normal. Well, the dead, the bereaved, and the victims of long COVID will never go back to normal. And normal was unacceptable to most people before the pandemic anyway. One minister was anonymously quoted as saying that the pandemic was all over bar the shouting. Well, that minister is wrong and the government is wrong. At the moment, the data shows that the rate of new cases and hospitalisations and deaths in relation to COVID are all running at 10 times more where they were this time last year. And there's a lot said about our vaccination programme, and it is a very good vaccination programme. But we also see in this country and other countries with a high level of vaccination that cases are still rising and the numbers of deaths are growing. And as many of us have warned previously, vaccines are not a magic bullet. They have reduced the rates of transmission, infection and death, but they have not broken the link. That's why it's wrong to say that we have to learn to live with the virus. Living with the virus is to get ill from it, to be hospitalised, and for far too many to die with it. That's why we need a maximum suppression approach, a zero COVID policy. We tried partial lockdowns, temporary lockdowns, which ended too early, and then encouraged people to go back to work, to school, to eat out. It has been in total disastrous. Far more people in this country have died from the virus than the total of British civilian casualties in World War II. That's what living with the virus means. The economy was not protected and the NHS was not protected. And the scientists tell us that with back to work, back to school and the flu season looming, the danger is that it will all happen all over again. I believe that we need to keep up the fight against COVID to ensure that we don't continue to see the levels of infection and deaths that we have seen. Zero COVID was the right policy and zero COVID remains the correct policy.
Thank you very much to Diane Abbott for that. Yes, indeed, zero COVID does remain the right policy. Our next speaker is Sarah Saul from Safe Ed for All. As people will know, most schools in England and Wales have now returned. When this happened a few weeks ago in Scotland, cases soared. Sarah will tell us about the situation in schools, what the government has done and what it has not done to make them safe. Sarah, welcome.
Hi, thank you very much for inviting me to represent Safe Ed for All. Where do we start? So for a full academic year, Safe Ed for All and many other parent-led groups and groups campaigning on behalf of clinically extremely vulnerable people such as shielders have tried to point out that the guidance that was issued to schools by the DfE has no scientifically recognised basis. It has no scientifically recognised mitigations for an airborne virus in place. Most of the guidance involves, it looks like they've looked at how schools run and they've tried to have some kind of hygiene theatre that involved hand washing, an open window where weather permits, and maybe some kind of grouping and bubbles. But in my case, for example, my son's school had bubbles of 300, which was totally unworkable and not what the whole idea of having a small bubble so you could contain infection was all about. So as I said, for a whole academic year, we have tried to work with school leaders individually, but we constantly get told we're following the guidance. So that doesn't get us anywhere. We've tried reaching out to politicians, we've tried reaching out to the DfE themselves, we've tried unions who are doing their best, I think, on behalf of their members, but their hands are tied as well in a lot of cases. And we have parents who basically are left with choices. One choice is to send your children to school to an indoor setting with no mitigations whatsoever, and run the risk, as I did, with my boys of how long it'll be until they return home infected. Or you can choose to not send your children to school and say you want to temporarily remote educate with minimum support from the school. And in that case, you get threatened with fines, social services referrals, all kinds of punitive measures to bully you into making sure your children return to school. Or you're told by the schools, you can end all that, just deregister. That elective home education will always be a choice, but how elective is that home education choice if you're doing it just to avoid being fined or having to send your children to an indoor space that isn't safe? That if you are trying to do the sensible thing as a member of society, as a socially responsible member of society, and prevent unnecessary infections, those spaces aren't the place that can prevent an unnecessary infection. So, we've had recently this grand announcement that in England and Wales, we're going to get some CO2 monitors in schools, but obviously not for when the term starts. They're not going to be in place probably till January next year. A CO2 monitor just is like an alarm. It'll tell you whether there is a need to improve the ventilation in a certain space. That doesn't improve the ventilation, it just tells you there's a need to do that. So what's the next steps? What are we going to do after we've now established how many classrooms and how many schools have an issue with ventilation? How long will it take? Another full academic year to improve ventilation? Ventilation can't be resolved always just by opening a window, particularly in the cases where on risk assessments it says open a window where weather permits. In other words, it doesn't matter about ventilation if it gets a bit cold or the rain's coming in. And as I live in Newcastle, I can tell you those windows were shut most of October and November last year. Masks, the silliness in this country over allowing the use of a scientifically recognised mitigation to prevent infection. To us, we don't understand this British exceptionist rhetoric that our children aren't capable of any age to wear them. We only had masks allowed in classrooms for a short period of time between March and May, and only in secondary and only optional. It was not mandated. So it seems like there's an awful lot of fuss over whether masks should be worn or not. Why can't it be down to the individuals to make that decision based on the knowledge that the virus is airborne? If we base every decision around making schools safer on some important facts, COVID is airborne, nobody is immune to being infected or transmitting, and nobody can guarantee how your body will react when you are infected. Some people who have had no underlying conditions have seriously suffered from COVID and have gone on to have long COVID. And then obviously there is the major critical thing at the moment that there are CEV children who were shielding, who have now had that revoked. They're now told that they are no longer clinically extremely vulnerable. Their condition hasn't changed and the virus hasn't changed. And in fact, the virus is now 26 times the infection rate it was last year when the schools returned. So there are so many issues right now that need to be tackled. We're obviously working with the Good Law Project now, and it looks like we will have some kind of action against the DfE for the inadequacy of their guidance. It's mainly aimed at improving the situation for those families who have vulnerabilities, whether it's a child or a household member. But we are taking steps in the right direction, but we're also supporting an awful lot of parents and school staff who they're faced with this impossible choice at the moment. I must send my child, or I must enter a workplace that doesn't have any of the necessary mitigations that you see are in practice around the world. There's examples of good practice. There's no longer any need for anybody to be trialing ventilation improvements or trialing, different interventions. They're out there. We can see what works. Let's get them in place and let's keep our schools open without unnecessarily and knowingly infecting any more children, school staff, or their family members.
Thank you very much, Sarah. Yes, definitely. There are so many examples this late into this pandemic of good practice. And so there's no longer any excuses on that. Our next speaker is Emmy Kelly from Shield Us. There is a huge number of people in this country who cannot be vaccinated vaccinated for one reason or another, some because they suffer immunosuppression as well. But the government's policy relies solely on vaccines, and beyond that, it's to let the virus rip. Emmy will tell us why that is so dangerous for this group of people and what can be done to push back. Welcome, Emmy.
Hi, thank you so much for inviting us on. The CEV and CEV households in the UK right now have no protection. We've had no protection, and we've had very little communication from the government. Like SafeEd, we are also supporting numerous amounts of desperate, heartbroken parents, spending 4 or 5 hours at a time on a call with a parent sobbing down the phone because their child, they don't have any means now that the clinically extremely vulnerable status has been removed from the children, any means to fight with the school to be able to continue remote learning. We are in a worse position now than we've ever been as clinically extremely vulnerable. We're not even recognised as being clinically extremely vulnerable. I'm still shielding. I'm 570 days on shielding, and I am following medical advice. The fact this government wants us to discard medical advice, to not follow the advice of your clinician, and this is life-saving for a lot of us. The fact that they've acknowledged now that us immunosuppressed don't have the antibody response to vaccines that we need, and we need a third booster. Where was the action and where was the communication to us personally as in the vulnerable group? Yes, they said a third booster. When's it coming, and how do we protect ourselves in the meantime? We've been on our own for a very long time, and the communication has never actually been there. What a lot of us are worried about for the winter coming up is how we access safe medical care if our hospitals do become overwhelmed. There's a real possibility of that, and we did face it last winter where people were not accessing care. They were not going to A&E when they should have, especially for people who have got respiratory disease, because automatically they've got to assume it's COVID, so they're put into the same day as COVID patient, and then it's a nightmare. To now know that NHS staff as well who are double jabbed don't have to self-isolate is really worried. Our clinically extremely vulnerable, and we're really concerned that our clinically extremely vulnerable have missed out on essential care all throughout the pandemic. Their backlogs are huge, and our clinically extremely vulnerable are not getting the care that they need, which is worsening their conditions. We've tried to raise the point that not everybody made it onto the shielding list. Even though their clinicians have agreed they're clinically extremely vulnerable or they're clinically vulnerable, not being on the list and the clinicians not having the power to actually add them onto the list has been a huge problem, and that's something we would really like to see, where our clinicians are given the assurance that they can make this decision for their patient on the individual health, because the children being removed from the CEV list, that was based on a blanket assumption of age. It does not take into consideration individual patient health. All along we've said we know our own health. Shielding isn't new to us. You know, wearing a mask, washing your hands, keeping yourself safe in the winter. None of this is new. What's new is COVID. And a lot of our people who are clinically extremely vulnerable before COVID would never ever have thought their lives were in danger, and there's been no support for them. Shielders is the only place we know of in the UK who supply immediate mental health crisis support to our clinically extremely vulnerable with our mental health team. There's been nothing. And we're still clinically extremely vulnerable, and given that Delta is so much more, since Delta is more contagious and it is putting more people in hospital, we know that vaccines are starting to wane for the people who were vaccinated in the first wave. These boosters can't come quick enough. And we're in a really difficult position. Very, very difficult position, because we've nobody to turn to. Nobody in government stepped up and said, right, I'm the Minister for the Vulnerable. We spoke to the APPGs, they've been absolutely incredible and so supportive. But our individual MPs, it's a postcode lottery. The same as it's a postcode lottery when you're working with your schools. Some schools have gone above and beyond and could not do more. But what we're finding this past 2 weeks is, with the new guidelines, the schools can no longer support. So we're into off-rolling. Now, for a lot of our clinically extremely vulnerable children, they're in specialist placements where they receive therapy at school that they desperately need to off-roll and lose that place, which could have taken years to get in the first place, all because of a blanket decision. Our clinicians need to be given more power, but we need to have somebody in government that is actually going to step up and be there for our clinically vulnerable, represent us around that table. We are still clinically vulnerable. The government can decide that we're not and try and decide that COVID's over and we must learn to live with the virus. We cannot live with a virus that we are at so much higher risk of dying from. And then we have the problem of long COVID. Every single day, there's people all around this country being diagnosed with cancer or starting immuno-suppressive therapy. When they're given that diagnosis, that's life-changing in itself. On top of that, they're then given a letter to tell them that they are clinically extremely vulnerable. It still exists, and still our number grows every single day. I think the last estimate was 3.8 million. It's a lot more than that now. And so many were missed off the list. So what we need is somebody in government to step up, look at the policies, look at all the different things that need to be done. There was never, ever full support put in. Our clinically extremely vulnerable were put on a sick pay. Now, if the person next to them in the office wasn't clinically extremely vulnerable, they were furloughed. Sick pays ran out. We've got CEV now in food poverty. We can't just stop being clinically extremely vulnerable. A lot of us have gone into what we call hard shielding, which was like during the first wave, because that's how unsafe we feel. But there's no support, there's no guidance. We're not written into any of the guidance anymore. We've got employers begging for support from the government on how to support the clinically extremely vulnerable. The same as we've got schools asking the same. But other schools, if it's not informed and it's not in the policy, how are they meant to know what we need? It's incredibly difficult. And right now, I know a lot of our CEV feel in more danger now than we've ever been in, because it's been made very clear that we've got to learn to live with a virus that could kill us. With long COVID, developing long COVID and getting organ damage from it puts you into the CEV, CD category. Where is the support? There isn't any.
Thank you very, very much, Emmy. And thank you and everybody at Shield Us for the campaign that you have there for the 3.8 million plus people that are in the similar situation. It is incredibly, incredibly shocking that so late into this as well, that there hasn't been any support. There hasn't been enough support, I should say. So our next speaker we've got is Vicky Blake, the president of the UCU, the Union for College and University Lecturers. Along with schools, colleges and universities will also soon be reopening. They face particular challenges in relation to the pandemic, both in terms of education and in health. We all remember the terrible scenes of students being locked down in student accommodation during the first lockdown without any proper support. So Vicky will tell us about the current situation and the response from students and lecturers alike. Welcome, Vicky.
Thank you very much for having me. And one of the first things I'd like to start off by saying is that, as well as further and higher education, we also represent members who work in prison education. And we do have an ongoing dispute of the Novus Prisons branch around health and safety. We're back in ACAS talks about that, but this has been a very protracted, long-running dispute. And unfortunately, within prisons, the number of COVID outbreaks is continuing to be quite high. As national restrictions have lifted, obviously there are people going in and out of prisons all the time. This has had an impact. And it's really important that for the protection of the prison population and for the people working there, that health and safety controls in those workplaces are proper controls and that they are properly risk assessed. So we have got quite a comprehensive set of guidance that UCU has produced for negotiating proper mitigations and risk assessments with every type of employer that we represent. But we are in a situation where we do still have disputes over this, where employers are being very recalcitrant. And you would think, after the length of time that we've already been dealing with COVID, that if we were genuinely in a position where we could say we can live with the virus, the only way we could live with the threat of COVID would be if we had proper mitigations in place everywhere, a zero COVID approach to the virus, recognizing that there will be outbreaks and that extra measures will have to be taken, but that a sensible set of preventative measures are in place everywhere to protect everyone. And I just want to really pay tribute to the speakers who've come before me this evening. I think Diane did a really great job of outlining every single failure that the government has had and are continuing to compound with ongoing failures. And I found it really moving listening to both Sarah and Emmy speak, because there is pain behind all of this that's going on. There is pain in being ignored. There is pain in people who have been locked away at home, feeling genuinely abandoned, not only by the government, but the way that the government has encouraged and worked with sections of the media to ensure that more of the general population also think that everything is fine, and also then begin to abandon our most vulnerable in the population. And that is inequality writ large. And it's actually more than gone in the direction of a eugenicist approach. And I'm really upset and really angry about it. And I don't think that we can say enough that everybody deserves to be kept safe and everybody deserves to be looked after, and that this government has completely failed and is continuing to fail. And I needed to get that off of my chest before I spoke about universities and colleges. And universities and colleges and in prisons, we have every type of person working in and studying within those environments. And that obviously includes people who need to shield, or people who have family members and loved ones, or people they, are close to in other ways who shield or who need to shield, and perhaps are being forced into situations where they cannot properly shield. And what we're seeing is a sort of a really worrying picture now. We've got high case rates across the whole of the UK again. We're very, very worried yet again that the movement of students around both nationally and internationally will exacerbate the transmission of coronavirus. We're now dealing with a much more transmissible variant than when we were warning of exactly this phenomenon last year. Look what happened last year. We have a situation where we can tell we're not wrong, because not only were we proven correct in being extremely worried last year, universities in Scotland tend to go back earlier than universities in England and Wales. And we know that the cases are already rising significantly in Scotland. And if any of you are on Twitter and have been watching the University of Strathclyde UCU branch tweet recently, those figures are truly, truly alarming. And it really makes clear how, in rushing to lift the mitigations such as mask wearing, such as, being very careful about social distancing, and basically becoming far too lax far too quickly, that was a rush that has impacted the numbers significantly and created a situation where, among our own members are people who research viruses and pandemics and every social and healthcare aspect of them, as well as the science behind how these viruses mutate and are transmitted. We are creating the perfect conditions, with the numbers as high as they are, without proper mitigations in place, to breed a vaccine resistant or a vaccine escape variant of this virus. Things are already bad with this Delta variant. Things are already bad with people who have been double jabbed getting poorly with coronavirus and transmitting it. Now, it is great that if you've been vaccinated and you are unlucky enough to get coronavirus, that you are probably going to have less bad symptoms than otherwise. But as many of our members and my colleagues and comrades are discovering, that virus is still awful, even if you have been vaccinated. And I'm starting to lose count of the number of members who are contacting me saying, I've become ill. I think I contracted this through face-to-face teaching. I've been careful in every other part of my working life. And this is happening in colleges, this is happening in prisons, and it's already starting to happen where universities are going back as well. So much like the demands that need to be made much larger and much clearer and need to be met, those demands need to be met in schools around ventilation, around mask wearing, and around proper measures with proper distancing and small class sizes and proper accommodations for people who cannot be physically in face-to-face situations. The same is really true in an extended way into the post-16 college and university and prison education sector, and in adult and community education settings. We have got 5 principles of a recovery that UCU has publicised, and these are that there needs to be a really clear focus on consistent and high quality education provision for all in post-16 ed, avoiding the disruption of last year. But that is not to say wave a magic wand, pretend COVID doesn't exist, and we'll just carry on like we used to do and live with the virus. That means that when it becomes necessary, we do move away from face-to-face teaching. We do provide online teaching, that we do make sure that access to vaccination is as easy and bureaucracy-free as humanly possible to be. And I'm going to give you an example later on of how that's already not been the case and has not been assisted by this government's failures. We need to have a very clear focus on ensuring the health and safety of all staff in the post-16 sector. And we believe that applies to literally everyone. We are talking, we represent our members, but we are talking about everyone, members of all unions, member of no unions, and the communities around us in those institutions. That the physical health of our students is protected, but so is the mental health of our students and staff across the sector. And I think that that has been really used in quite bad faith ways by those who seek to just return to blanket face-to-face, don't worry about ventilation, let's just pretend everything's fine brigade. Your mental health in a pandemic is going to be very much affected by your physical health and the risks that you are placed into. You might be lucky enough not to contract this virus, but if you are living in fear of it because you know that there are all kinds of mitigations that should be in place that aren't, if you are put in the position of putting loved ones at risk because you are in an environment that people are not wearing masks, that people are too close together, that there is not proper ventilation, that is going to affect your mental health, whether you are a staff member, whether you're a student. If we end up in a situation again this year, like we did last year, with students effectively imprisoned in halls, that affected our students' mental health very, very significantly, and it will do again. So there really needs to be proper investment in that mental health provision. And that what we need is for education settings to be centres of excellence around how we handle this virus and around how we protect each other, not centres of community COVID transmission, which I'm sorry to say the evidence from Scotland is already pointing towards it being yet again. And we need adequate funding to be made available. And that's just a really basic fact that you would have thought that even a Tory government might have got their head around by now. And the example that I might finish on, that I'm going to give you, is just one of many failings, but it's something that has been coming to light recently. We obviously have international staff and students, as well as students who are travelling to universities from within the UK. In order to make sure that we are being fair to migrants generally and to migrants who work and study in our institutions, we need to ensure that they are not met with prohibitive costs around quarantine, that quarantine is properly supported, that they are also properly supported to get vaccinated, and that this then feeds into a situation where they're kept safer when they're travelling and they're kept safer when they're coming into the UK to work and study. So what you need in that situation is to reduce the cost and to reduce the bureaucracy. However, unsurprisingly, the government has not cracked even the basics of this. So in Edinburgh, we're getting word from our members there that yet another failure of yet another outsourced debacle, where some students are not getting the clearance that they need to travel. So they're literally being turned back home at their own local airports because our certification system is not functioning properly. So not only do we not have proper measures in place once you get here, not only have we reduced mitigations in a way that I can only describe as absolutely as if we were trying to make the situation worse rather than better, we can't even get our own certification systems for the things that we said we were going to do right. And it's just time that we find ways to come together and unite against the horrifically pernicious, bad myth laden, completely off the wall in many cases, the spreading of misinformation that is further damaging and further promoting the spread of this virus. I don't want to be here in another year from now, looking at another academic year from now, about to make the situation that's gone on far longer than it should have even worse again. So for the good of everyone, we all need to be in this together. And I think we need to find ways to really join together. So you may see some of our members in dispute. You may see some of our members invoking their rights under various bits of legislation. But the important thing is that we all support each other across all sectors and across all communities. And again, thank you for having me. It's a sad pleasure, if I can put it that way, to be here with you this evening.
Thank you very, very much, Vicky, and thank you to the UCU for leading on this, and solidarity with you all and all your members. So I'm very pleased now to welcome back Bel Ribeiro Addy MP, who is a long-standing supporter of our campaign of the Zero COVID campaign, a brilliant campaigner and a brave one who will not be deterred from fighting a just cause. Welcome, Bel.
Thank you very much, and thank you so much for inviting me to speak again today. Now, the government, and they were saying as much today, would tell us that the pandemic is effectively over, but I think that ministers are delusional if they really do believe that. When we last had a zero COVID meeting like this on the 19th of July, so-called Freedom Day, we saw there is no freedom in the rising infections or deaths. Well, to put this in a wider perspective, there were almost 800 deaths in the latest week, and over 6,500 people were admitted to hospital. This compares to 60 deaths in the same week last year, and there were fewer than 1,000 people hospitalized. So we're in a completely worse situation from last year. This starting point is far worse. And we've already seen in Scotland, as you've just heard, how the reopening of schools has led to this surge in cases. But I imagine that most of the people on the call this evening are aware of some of the terrible data, and are as anxious as I am about the situation overall. So I want to focus on the question of policy and why we actually still need a zero COVID strategy. Because the demand for a zero COVID policy has come under widespread attack, both in this country and internationally. In Australia, it's possible that the government is buckling under the pressure to abandon its own zero COVID policy from a combination of right-wing media, right-wing politicians, anti-mask or anti-vax protesters, and international pressures. And I would like to say that whatever mistakes have been made, Australia has had 1,000 deaths among 25 million people. Our death rate here in the UK is almost 50 times greater. But here, the zero COVID policy has also come under attack, despite the fact that it's never been implemented. The Zero COVID Coalition has come under attack from the Financial Times, the Sun, the Daily Telegraph. So something of a badge of honour in many ways. Now, the health correspondent from the BBC has even argued that we can't have zero COVID in this country because the case numbers are too high, which obviously makes absolutely no sense. So how do we explain that? How do we explain why these attacks on the policy itself are coming about and on the Zero COVID Coalition overall? It's not as if this is a live debate in government circles. I can tell you that, it's certainly not. Nor can we say that the government paid advisors are pushing the policy, although some members of both SAGE and Independent SAGE have spoken at these meetings. I think we should say that the zero COVID policy is a threat to the current policy because it's the only coherent and viable alternative to the status quo. It's the only workable alternative to the carnage that the current policy has brought us. The attacks are preemptive. The current policy doesn't work and it never will. Vaccines, of course, do an outstanding job. We should all be grateful for them, but it's clear that they can and do mitigate the spread of the virus as well as protect the infected. But they do not prevent infection, including serious infection, and of course, they do not prevent deaths. We already have almost 90% of the adult population vaccinated with a single jab in this country, and almost 80% are double jabbed. There is not that much more we can do in terms of vaccination. Yet cases, hospitalisations and deaths are all much higher than a year ago. On September the 2nd this year, there were over 7,500 people in hospital with COVID-19. And on September the 2nd last year, there were only 828 in comparison. So one obvious failing of the current policy is that the NHS is under enormous strain. It's absolutely heartbreaking to hear of people who are reluctant to get potentially life-saving treatment because of COVID, but even worse in some ways, if people can't access life-saving treatment because of the pressures on the NHS. This is what the current policy has led to. The current policy also relies solely on vaccination, which we have long argued is not a magic bullet. Other than that, the policy is to let the virus rip in a completely reckless policy of herd immunity by infection. The fact that infection leads to hospitalisations and death doesn't seem to figure in this government's calculations, or that there will be mutations, which we're seeing more and more of. At the moment, the Delta variant seems to be so powerful that the virus itself has little need of further mutations in order to survive. But scientists tell us that this policy of partial vaccination and free circulation of the virus is the ideal breeding ground for new strains. Yeah, if all of this is a consequence of the current failed policy, why do they persist with it? Well, there is a clue in the main false allegations against the zero COVID policy. So the argument from the government supporters is zero COVID means permanent lockdown. Of course, this is completely untrue. The countries pursuing zero COVID have had far fewer lockdowns days than this country has. And the difference is they maintained the lockdown until the virus was suppressed, as well as operating properly functioning systems of test and trace and fully supported isolation. So they have also added efficient programs of vaccination. So they did it the right way. And in that way, both China and New Zealand have successfully eliminated the Delta variant outbreaks recently. And it's a winning combination. Others are actively trying to do the same. But the false allegation that we want permanent lockdowns betrays something else. This isn't about public health, but rather the economy, or more accurately, the private sector of the economy. This is why civil servants can work from home, but teachers must be forced to return. This is so parents and carers can be forced back into private sector jobs. Now, this doesn't work even on its own terms. We have the worst economic slump in the whole of the G7, precisely because this government kept on opening up too soon and had to have too many loopholes in the lockdown. And that was the worst of all worlds. Now, many economists seem genuinely fearful about job losses once furlough comes to a complete stop at the end of this month. Millions of workers are still on furlough, certainly more than 2 million and maybe as many as 3 million. And the fear, quite rightfully, is that when furlough ends, these businesses that have not reopened won't actually be able to reopen, or at least a proportion of them. So if that does happen, we're actually looking at another major round of large job losses. Now, this government's failure in closing the furlough scheme while there is still a pandemic and the after effects of a pandemic continue to show that even on the government's own priorities, this policy of living with the virus really isn't working. I want to end on a positive note, if there is one. Firstly, I noted that some media attacks earlier, so it's only fair to highlight supportive comments too. At the last month, the Daily Mirror ran a very, very short editorial titled "Why Doesn't This Government Care That the Coronavirus is Still Killing People?" It went on to say, with experts warning of a back-to-school COVID surge, what feels again like indifference and disinterest at the heart of the government is frightening, because this killer isn't yet beaten. And today's reported 61 deaths and 33,196 fresh infections across the UK are a grim reminder that the virus is still taking lives, despite the remarkable success of NHS vaccinations. And some of us may even know people that have had 2 vaccinations and may have been seriously hospitalised or lost their lives. Now schools have returned early in Scotland, as we heard, but in England, where the Education Secretary, Gavin Williamson, makes every problem worse, parents and families are growing understandably concerned, and no one no one with any sense ever pretended decisions would be easy when it's necessary to return life to as normal as possible while still suppressing this deadly virus. What we are all entitled to expect, however, is rational leadership, and that, unfortunately, is not on this government's curriculum. Secondly, public opinion is with us. Opinion polls show that the public is dissatisfied with the government's handling of the crisis and wants to see it end. And I believe, and I'm sure we all do here, that with zero COVID, that's something that we can definitely do. Thank you.
Thank you very much, Belle, and thank you for all your support. Next, we've got another incredible Member of Parliament, the Member of Parliament for Leicester East, Claudia Webb. Thank you for joining us, Claudia. Claudia is a long-standing supporter of the Zero COVID Coalition, and we are just so delighted to welcome her again this evening.
Thank you very much, and I hope you can hear me. It's, of course, a pleasure to join you all for this important event. I would like to thank the Zero COVID Coalition, not only for inviting me this evening, but for all the work you do in the service of public health and equality. At the very start of the pandemic, this government of the super rich, keen as always to prioritise the economy over human life, decided on a herd immunity strategy. They only changed tact after projections that such an approach would have cost almost 250,000 lives. The government then lied that this was ever the policy, despite being on record saying exactly that, and got away with it due to our compliant media class. Yet now, as the government effectively pretends the pandemic is over, despite stubbornly high cases and dozens of deaths per day, they have returned to a policy of herd immunity by stealth. Whilst I share the understandable desire to end restrictions and regain a sense of normality, it is a grave error to end all restrictions in June, as the Delta variant was on the rise and the vaccination programme had not been completed. As a result, daily hospitalisations, as we are seeing, are 8 times their level at the same time last year, and deaths 10 times where they were 12 months ago. And this is before the flu season begins, the wider return to school and as possible, and as people are pressured to return to workplaces. We are already feeling the pressure here in Leicester, where schools returned 2 weeks ago. There will be increased pressures on the NHS as the weather cools, and there are inadequate protections for workers, the vulnerable and the immuno-suppressed. Public health measures or societal restrictions can be very challenging, but they are not as horrible as contracting or losing a loved one to a preventable disease. In addition, scientists warn that a partially vaccinated population and a freely circulating virus are the perfect conditions for the development of even more threatening strains. We cannot risk a vaccine-resistant COVID-19 variant. In response to the surge in cases, the government has dispensed with all previous rules and guidance, including common sense measures like mandatory masks in public places. This is pure recklessness. Instead of being protected by their government, too many vulnerable people are now faced with a choice between staying at home and risking catching a deadly virus. The government now preaches personal responsibility. Yet this is not going to end this crisis. A communal approach is needed. Mass social distance and hygiene measures need to apply to all of us if they are to work, because those who don't observe these measures can infect others, even if they themselves aren't in danger. Common sense. Yet this collective effort is antithetical to the government's dogmatic right-wing individualism. When Margaret Thatcher said there is no such thing as society, which of course could equally be the motto of her ideological descendants that are in government today, she clearly wasn't thinking of an effective pandemic response. Only a collective appreciation of our responsibility to one another will end this crisis. One of the main drivers of infections is that too many people in the UK simply cannot afford to isolate. The UK offers the third worst sick pay rate in Europe, which is significantly less than the national minimum wage. 7 million workers are not even eligible for statutory sick pay, including care workers on 0-hour contracts who make up a quarter of the social care workforce. This means that many essential workers are forced to face the impossible choice between keeping themselves and their community safe or financial destitution. The government must increase the level of statutory sick pay to at least the level of the real living wage so that people are not pushed into poverty by doing the right thing. We must also end the insecurity and precarity which defines the lives of too many working class people. The pandemic must herald the end of an era in which too many of our people live paycheck to paycheck. We must also extend and make permanent the eviction ban, which was cruelly lifted in May. Every community has been hit by this crisis, but it has especially impacted the poor, the vulnerable, and the oppressed, including those in lower paid work and who cannot work from home. African, Caribbean, Asian, and other racialized communities, the disabled and those in poor housing are amongst those hit hardest by this crisis. My community of Leicester East has been under lockdown or enhanced restrictions longer than virtually any other area in the UK. The disproportionate suffering of areas like Leicester is a damning indictment of the government's failure to prioritise public health and implement a zero COVID strategy to suppress the virus. Yet the government continues to make the same mistakes over and over again. So as summer ends, schools return and vaccinations increase, the case has never been clearer for a zero COVID approach that prioritises public health over private profit. The government's handling of the pandemic has been defined by a belief that there is a trade-off between, The government's handling of the pandemic, I hope you can hear me, has been defined by a belief that there is a trade-off between health and the economy, and it is clear which side they are on. Yet this is a false distinction. Our unacceptably high death rates is in fact largely due to the government's many attempts to prioritise the economy from the initial herd immunity strategy, the eat out to help out, who remembers that, the rush to allow people into high streets to do their Christmas shopping, and the decision to fully relinquish all restrictions before the vaccination programme had been fully rolled out. So as Independent Sage argues, the government must, in my view, follow the best examples set by countries across the world, especially East Asia and the Pacific, and adopt a zero COVID strategy. This is the only way to prioritise the protection of everyone in the UK, and especially those who the virus has disproportionately affected. We also simply cannot return to the pre-pandemic world. Those who are happy to let the pandemic rip through our society, talk a lot about freedom. Yet what is this freedom worth? The freedom to be forced to commute and work in an office rather than flexibility? The freedom to be evicted? The freedom to catch a deadly virus? The freedom that I hold dear is that which values every human being and which ensures that every person in this country has the security to build a happy and stable life. That is not the freedom that this government has on offer. It is up to us to continue to fight for this true freedom, as well as a zero COVID strategy and a society which is built around everyone's needs health and well-being. So solidarity, my friends, solidarity. Thank you.
Thank you very much, Claudia, and solidarity to you and all your constituents in Leicester East as well. Our last speaker, I'm so delighted to welcome back Deepti Gurdasani. For those who have not had the pleasure of hearing Deepti speak before, fantastic speaker. She's an epidemiologist who is a machine learning researcher at the Queen Mary University of London. Throughout the pandemic, Deepti has put forward crucial arguments for public health, which has led to being a strong critic of the government. Welcome, Deepti.
Hi, thanks for having me. I actually don't have a presentation prepared this time because I always overrun, so I'm just going to say a few things. So I'm really, really worried about where we are in the UK right now. I'm probably more worried actually than I've ever been during the pandemic. I think we're in a crisis in England. And actually, I think in all nations of the UK where we have a lot of reason to be concerned, but there's a sort of dystopia around us where we're told that everything is normal and everything's continuing as normal and it's all right. And while that's happening, you know, we're seeing 260,000 people get infected every week. We're seeing 800 people die of COVID every week as if that's something that's normal. And we're seeing 1,000 people being hospitalized with COVID every day with huge pressures on the NHS, A&E departments, and frontline workers telling us that they can't cope. And we aren't even in winter yet. And what's worse is we've gone into the new term of schools with no preparation. So we have unvaccinated children now having gone into crowded classrooms, and any mitigations that were in place have actually been removed rather than strengthened. So if I have COVID today, my daughter has to go into school tomorrow. In fact, it's mandatory for her to go into school. She cannot isolate. And similarly, if she sits next to a child who's infected, who then isolates, she still has to continue going to school, and she won't even know that she's a contact, and she won't even be asked to get tested. All of these are the actions I would take if I wanted to produce a scenario of mass infection, which is what's happening in schools now. Scotland, 2 weeks ahead of us, is seeing a massive surge of cases. I mean, they have 2% of their adolescent population getting infected every single week. That's huge. And that's our future. We're not very, very far from there. And, you know, we have even fewer mitigations than they do. Thousands of children get infected every day. So currently, about 7,000 under 18 children get infected every day. 1 in 7 of them go on to have persistent symptoms for 3 to 4 weeks. That's 1,000 children developing, 3 to 4 months. That's 1,000 children developing long COVID every single day. But somehow this is normal. In this country, we've normalized mass suffering, mass disability, mass death. I mean, 800 deaths a week that were preventable. I mean, we have vaccines. We can put in place mitigations. Countries like New Zealand, Australia, Southeast, so many countries in Southeast Asia, China, they have deaths in the double or triple digits, not where we are right now. But we've been told that this is acceptable. And of course, you know, this suffering and these deaths are occurring people who are most vulnerable in society, who've been sort of left to fend for themselves. The so-called freedoms for everyone have sort of meant that people who are disabled with chronic illness, immuno-suppressed, are essentially going to have to shield forever. There's no end in sight for them. And you know, we're seeing that this idea of acceptable deaths living with COVID is sort of the recipe for forever COVID. I mean, I heard someone talk about very, very high risk of variant evolution right now. And that's absolutely the case. I mean, if you actually look at the data that's coming out of the UK, we see new mutations becoming common on the Delta variant every day. When does the Delta variant evolve to become even more likely to escape vaccines? It's happening right there in front of us as transmission continues. I mean, we need to remember we've had 30 to 40,000 daily cases for long periods of time. And in the past, we sort of had rapid increases and then rapid reductions. What we have now is mass infection continuing to the population and rising. It's been rising gradually, but now it's rising more rapidly. And that means the risk of a new variant emerging is high. there is no end in sight here unless we take action. We have agency to do it, like many countries have done. And if anything, the Delta variant, which has emerged to be more transmissible, more severe, should tell us that the only way out of this is not living with the virus, because this is a virus that won't allow us to live with it. The only way is coordinated elimination alongside vaccination. Vaccination alone is not the panacea or the tool that can take care of it by itself. In fact, we need to protect vaccination. Had we not had the Delta variant, it's quite likely the situation would be very different. But we were quite cavalier about importing it and then letting it spread through schools. And here we are now, as is the rest of the world. And if we don't want to do a repeat of what we've done again and again, we need to focus on globally coordinated elimination, because that's the only way that society can return to normal. This is not a normal. This is terrifying to have a government that's in denial and pretending that everything's normal while people around them continue to die, suffer, and develop chronic disability. I mean, between last month and this month, the number of children with long COVID has increased substantially. We now have 11,000 children who've had symptoms for more than 1 year. Tell me a disease that's done this to children that we've said is acceptable to live with in the past, that we won't even vaccinate them for. I can't think of a single one. And yet we are told that we must accept this. And it's very, very important that we reject this entirely and push the government to do its duty, which is to protect its citizens. Thank you.
Thank you very, very much, Dr. Gurdasani. Thank you for that. Okay, so our next meeting of the Zero COVID Coalition will be September 23rd, which is just ahead of the party conference season. So please, if you could all put that in your diaries, we'll send information out closer to that date. I do want to thank everybody for joining us today. I want to thank our fantastic panelists and the brilliant campaigns that they represent. We've got Sarah from Safe Ed for All, Emmy from Shield Us, we've got Vicky Blake, President of the UCU, the fantastic members of Parliament, Diane, Bell and Claudia, and the brilliant Deepti Gurdasani. Thank you all for joining us. Thank you for everybody who's tuned in and live streaming this as well. Have a wonderful evening.